Fox News alert now on progress on the COVID-19 vaccine front as biotech company Moderna reports very positive results from an early human trial, which did show that people given its potential vaccine generated antibodies to the virus. Joining us now is Alex Azar, Health and Human Services Secretary. You read through the details that Moderna has released. Its stock is skyrocketing 17% today, Mr. Secretary, and welcome. Markets are up in anticipation of this as well. How confident are you that this could be the game changer that could lead us to a vaccine by end of year?
Well, President Trump is leading Operation Warp Speed, which is going to put bets on several vaccines. This one, the Moderna vaccine, was actually invented here at NIH, and within 8 weeks, we brought that to clinical trials. It's really historic, as you said. Some very promising data showing the vaccine provokes what are called neutralizing antibodies that attack the virus. And so just really important advance, and we're going to be putting other big bets on other vaccines, so we're not going into battle with just one shot.
Mr. Secretary, talk about next steps there in maybe kind of a multi-pronged approach here, because while you've got Operation Warp Speed on the vaccines, you also have states reopening pieces of their economy. Our own Pete Hegseth has been at a gym in New Jersey, to give you one quick example. And initially, the police were standing outside and were maybe going to shut this gym down. And he's now reporting that, in fact, they went inside, saw that people were social distancing, and despite the governor's lockdown orders, they're going to let this gym move forward. Talk about what you're seeing in terms of balancing reopening the economy and making sure people are safe.
Yeah, I'm glad you asked about that, because so often we're describing this as a conflict between health versus the economy. I see this as really health versus health. There are very serious health consequences from being locked down for extended periods. We've seen reductions in cardiovascular procedures. We've seen increases in suicide risk. We've seen reductions in cancer screenings and pediatric vaccinations. These are real and significant health consequences, and we've got to balance that against the health benefit of stay at home. And we believe, thanks to the president's historic response, that we can get back to work and back to school with appropriate mitigating steps to resume our lives and resume the great and important work of our economy.
What evidence have you seen so far that the reopening of some areas of our country is going well, as you have previously said? Is it too early to tell, or is there conclusive evidence that things are looking up?
No, it's the right question. I'd say it's still too early to tell in terms of data. So we've got states like Texas and Georgia, which are reopening, Florida, which did not do as severe of a lockdown, where the data trends seem to be good, with the exception of certain concentrated outbreaks like meatpacking facilities. But it's still too early to tell. We'll watch that data. And I think it's one of the brilliant parts of the president's strategy here of respecting federalism. You'll have a diversity of approaches in states, and that will really be a laboratory for us to see what works and what doesn't work. It'll be very important, but we'll be cautious and appropriate, but we've got to work to get this country back to work.
Mr. Secretary, there are pieces where you can let the state go forward and take the lead. There are other parts where maybe the federal government has to step in, for example, where we see this syndrome in children, particularly in New York, but maybe other parts of the country. There's one 9th grader saying that it felt like someone injected straight up fire into their body. And doctors at this hour are trying to figure out, is it related to COVID? What's happening? What does the federal government know about this syndrome, and what are you doing to make sure our kids are safe?
Yeah, so it is fortunately a very rare syndrome. It's comparable to what we call Kawasaki Syndrome. It's an inflammatory response. Essentially, your body is getting provoked by this foreign body, the virus that's in it, and our immune system creates this inflammatory response. And this is a rare outbreak, but we are working across the world with our colleagues and other health ministries to gather data on this, to study, to see what do we know, what are the best treatments for this, and how do we help these kids who get it.
Considering that, and considering Dr. Fauci's words about how we have to be so careful with how this virus behaves, in particular how it behaves in children, still we don't know a lot. How hopeful are you that kids will be able to go back to school in the fall, Mr. Secretary?
Well, we'll have to see how the disease progresses over the summer, but I'm quite hopeful. I think we need to get back to school. There are ways that we can bring back our economy and bring back our lives in smart, sensible ways. Take schools for the example that you raise. Maybe we minimize auditoriums and big gatherings at our schools, and maybe we arrange our seating in classrooms appropriately. But there are steps that we can take that are short of locking ourselves in our homes that allow us to function and get back closer to normal as we progress. Even as under the president's direction with Operation Warp Speed, we bring therapies to market, we bring vaccines to market, and of course we have the world's best testing system now in place.
Mr. Secretary, earlier today you spoke virtually to the World Health Assembly, a World Health Organization at the center of that, obviously, and you said today one member state, you didn't name them, tried to conceal this outbreak. I think everyone pretty much knows you were pointing the finger at China. Please expand upon that and let us know as well. The president has threatened to cut off funding to the World Health Organization, in part because they helped China cover all of this up at the beginning. Is the president going to cut off funding to the WHO or not?
Well, I'm not going to get ahead of the president making an announcement, but I'm going to tell you I delivered at the president's request an extremely stern warning and message to the World Health Organization today, which is that they're in need of significant structural reform. They've got to be held accountable. There needs to be an independent investigation of them. But their conduct towards China here and China's conduct has got to be on the table. You know, China concealed information about human-to-human transmission. They did not reveal the asymptomatic transmission of this disease. And for a month and a half, while I personally fought to get CDC and World Health Organization people into China to learn this kind of evidence, they resisted. For an entire month and a half, precious time was lost when the world community could have been learning, and China concealed viral isolates and other evidence that we needed to be able to treat people and prevent the spread of this disease. And they shut their own cities down while having people continue to fly around the world, seeding the rest of the world with the virus.
Mr. Secretary, finally, when it comes to finger pointing, obviously we're looking at China and what happened there. But here at home, the president's own economic advisor, Peter Navarro, has gone on the record pointing fingers at the CDC for early on what he referred to as bad testing. He said it, quote, set us back. How do you respond to that this morning?
Well, the comments regarding CDC are inaccurate and inappropriate. The CDC had one error, which was in scaling up the manufacturing of the test that they had developed. There was a contamination that didn't affect the accuracy of the test, just led to inconclusive results. They fixed that within weeks and got it out. That was never going to be the backbone of testing in the U.S. That's low throughput public health lab testing. What we need is the private sector to develop the tests. The Abbotts, the Roches, the Thermo Fishers, get them in the market, get those high throughput tests that now the president is delivering 300,000 tests per day, over 10 million tests, 12.9 million will be done in just the next several weeks. That's the private sector brings that to bear. That's not the CDC. That's really leveraging this whole of government approach that the president has marshaled here.
Okay. Alex Azar, the Secretary of Health and Human Services, we appreciate you coming on today. Thank you, sir.
Thank you.
Thank you.